And our third presenter is Barry Kramer on breast cancer screening.
Yes, I can't start without first thanking the meeting organizers for even inviting me here. This is not what I do every day, but is a strong interest of mine, and already this meeting has stretched my horizon of knowledge, and for that I'm very grateful. I also want to thank Phyllis, Pettit, and Nassi, who spoke to you yesterday, and Lynn Hall, who served as our recorder and helped me refine my remarks I'm about to make. So we were given two sample questions to start our thinking. The first is on a scale of 1 to 10. Where do you think breast cancer screening falls in terms of public trust? Now, we reformulated that question because the goal is not to retain, sustain, or increase the trust in actual screening. As a matter of fact, there's some evidence that high quality information and information that respects the values of the public actually might lead to diminished trust in the actual technology and what it can accomplish, or at least leads to different intentions for action on the part of women. So the goal really is to increase trust in messages and trust in the methodology that led to the highest quality messages, and that gets to the issue of increasing trust in the science and the scientific methodology that serves as its pillar. The second question was, and we don't know the answer to that, and I suspect that it ranges from 1 to 10. And it may even be bimodal, and therefore an average means nothing when you take people who have zero trust and average them with people who have intense and very deep trust. So I'll leave it at that. But now, what action items and components of trust do you think are particularly critical in public engagement? So we focused on action items, and we focused on public engagement. There are other communities of engagement, some of them scientists and so forth, and I'll get to that in a little bit. First and foremost, we need to do a better job at making sure that the strength of messages matches the strength of the actual evidence. And if the evidence is not as strong as it could or should be, or is not ideal, then we need to convey that. Convey our level of confidence in the message. If we don't do that, we start to slip out of the role of science and into the role of advocacy. And there's a very clear distinction between the two areas. Science really is built upon uncertainty. It almost demands uncertainty in order to make new discoveries, whereas advocacy demands certainty. And so it's very dicey when we take on the messages that are far too strong, and even do research on how to make the message as strong as possible, irrespective of the strength of the underlying science. And we need to be very careful of that, because it's very difficult for experts or organizations to back off of a message if their message has been too strong and wasn't supported in the first place by the evidence. So there were good examples. We're taking baby steps. These are action items that are in place, and then there's plenty of room for doing it better. One is the U.S. Preventive Services Task Force tries to be very explicit about their confidence in the body of evidence. And they have a grading system that lets the public know whether they're so confident in the magnitude of the effect and the direction of the effect that further research is highly unlikely to change that confidence. They have a lower grade, that is, they're confident of the direction of the effect, but not so much the magnitude. The next level down is they're not even confident in the direction, and additional information could cause them to flip into another category pretty easily. Then the next level down is they're quite confident in the net harms, and so and they don't think that will change. And then there's finally insufficient information. Now there was a and the PDQ, the National Cancer Institute Physician Data Query, attempts to do that, not with letters, because letters sometimes are difficult to incorporate into concepts, We try to do it in wording, standardized wording that conveys how strong we think the message deserves to be because of the strength of the evidence or lack of strength. But there's plenty of room to go. There is research on ways to do that, graphics and words and letters, but that's an area for research. Now, when I say research, we don't necessarily need to convey that at the end of every message to the public, more research is needed, because that's almost a non sequitur. But when I say research, I mean internally, the research community should take as an action item working on methods to develop more understandable messages for the public. Then engage the media, because they are the final common pathway often to the public. They are supposed to be the honest brokers, and there's no way that they can convey the message accurately and respectfully without having an understanding of the scientific method and the types of things that we deal with. And so curricula for the media, engaging the media at every, Mary said this, we can't abandon the field, the arena, to others. We have to work with the media to get out the message in a respectful way and understandable way. The next way to engage the trust of the public is to respect their values. And too frequently, the messages that are out there have a soundbite in screening, and breast cancer screening in particular, have a soundbite quality to them. Now, they are toned up to evoke action, and it's sort of an advocacy point of view, but I think that the public loses trust if you don't actually respect their values. And the way to do that is to be more neutral about the messages when the messages should be neutral. And there are ways we know how to do it. Research has told us that certain types of graphics are more engaging and more understandable. Certain types of numerical presentations are more engaging and more understandable. For example, relative rates are poor, absolute rates are a lot better. But exactly which type of absolute rate is, we don't know for sure. We know to start using absolute rates, but how to do it is a matter of research, so that is action, both in terms of how we craft the messages and action in terms of further research in improving respectful messages. And therefore research on framing the messages we all don't know, and the framing may differ, optimal framing may differ among subpopulations. So as an example, there were discussions about the power of the story for certain populations, but other populations don't respond at all to the story. They respond to more quantitative information. If you use stories, which can be compelling at least for some groups, you have to be sure that the story reflects accurately the body of evidence, and that is an art in itself. So many times a newspaper article or a TV show or a VIP may be very misleading because the story is really dissonant with the body of evidence. And so it's just as difficult to come up with the right story as it is to come up with the right quantitative message, and again, areas for action, but also research. And then finally, and this is the train has already left the station type of action item that I mentioned yesterday, and that is as early as possible, we really need to engage the public in learning about probabilistic thinking, learning how to always question pros and cons, go through sort of an internal analytic framework that would serve them well, so that they no longer think that every single test, no matter what it is, a screening test, has to be good for you. There may also be harms, and train them to think about asking about the harms, and train the health professions, who often are very poorly trained in the first place about even conveying these trade-offs or framing the message in a very respectful way. And then finally, an action item, of course, is many people, despite the information, may feel like it's overwhelming, and then it is the duty of the profession to say, if the patient says, if it's that complicated, I can't make the decision, what would you do? And help them out that way. And this is a little bit different from the other topics you talk about. This is one of the most divisive topics in all of academia, and where we have academicians clashing. I can only think of one more contentious topic, at least in my career, and that is office space and
You mean it's more contentious than parking? Any burning questions for Barry? No?